Hello, my name is Patrick Aisfair.
And my name is Fitz Kelly Edmond.
We're here to talk about Bounce Back, a cognitive behavioral therapy program for children who experience trauma and natural disasters.
Unfortunately, children cannot control what happens to them in life. Sometimes bad things happen to unsuspecting people. We know that young students may not have adequate support when those things do happen to them. For example, we have children who experienced the bridge collapse in I-95 in southeastern Pennsylvania, around the Philadelphia area, and we have children who have been really negatively affected by the Canadian wildfires that took place in the same week. Now, when you incorporate a program like Bounce Back, what you allow the students to do is you allow them to, while in their schools or sometimes even the community, be exposed to people who can help them get over whatever disaster may befall them. Those disasters will be explained in a little bit. Stick around.
The reason for our intervention is because, as previously mentioned, not every child has a reliable person in their life that can adequately help them deal with this trauma, especially for those who deal with a lot of these natural disasters, such as the I-95 or Canadian wildfires. Some students may have their teachers or additional staff to help them, or even their parents, but those people may not be fully capable of helping them, especially for those children who feel very isolated and who refuse the assistance because they feel more like a charity case. Although this is not a common thing, it is uncommon enough where it has to be stated, and it has to be reassured for the student and the children that they'll be okay and that they're not, that we are here to help. Upwards to around 50% of children report PTSD symptoms following a disastrous event, which in my eyes is a very large number, and I would like to for us to like drop that down. And so that's why we like to bring in Bounce Back to really assist with this.
Let's actually dive into what Bounce Back is. So, Bounce Back is a program meant to help with early elementary school intervention for children who suffer from childhood trauma. The program is a 10-session group intervention, like a group setting, that utilizes cognitive behavioral therapy, or CBT for short, to mitigate symptoms of PTSD, depressive and anxious symptoms, anxiety symptoms brought upon by acute traumatic events. The program has to be approved by the child's parents or legal guardians, or else they won't be able to work with said child. It is an adapted form of CBITS, which is essentially cognitive behavioral intervention for trauma in schools, which includes more parental involvement and activities designed for the younger populations. When we're talking young, we're talking late toddler to late tween years, like prior to teenage years, at the tail end of toddler years. That's the age range we're looking at. Um, Unfortunately, if a child who suffers from trauma has that trauma left unattended and ignored, the said child would be at risk for academically, socially, psychologically declining.
The components for the Bounce Back program can vary, but some of the more consistent ones are for the parents to first accept the program for their children, and then the children will get screened. This will allow the counselor or the therapist to really have the students who need the treatments be on a higher list, very much like a triage treatment for first aid. Uh, with these screenings, they're able to identify the severe symptoms after disaster. These would include severe anxiety, depression, flashbacks, nightmares, night terrors, loneliness, survivor's guilt, and dissociation. For a lot of children, this is extreme, especially for younger children, closer to the age of 5 and 6. That is when bedwetting would still occur, and that is a very common symptom with something like this. Uh, but Bounce Back will although it is a form of CBITS, as previously mentioned, uh, it focuses much more on the younger audience, as Bounce Back focuses, as previously stated by Fritz, uh, for ages like 5 to 11. So right before the teen years and right after the very young adult, not young adult, young child years. Um, and this program will use a lot of psychoeducation to help the students uh, feeling identification, positive activities, and it'll provide a more support for them as well as add some relaxation training. So when students feel either stress or anxiety starts to build up with extreme amounts, they'll be able to learn how to cope and how to redirect their emotions. With the feelings identification, they're able to be able to identify and truly understand what they're feeling. As with a lot of students, they feel a lot of dissociation because they feel anxious, they feel scared, they feel just about anything they could. So we believe bounce back and these components are very beneficial for these populations.
Bounce Back's target population, as in like the population that they want to work with, they work with best, and the population that benefits the best from what they aim to do are children from almost any background. Bounce Back is very inclusive, is very, you're allowed to come in no matter what your background is. And regardless of what your background is, Bounce Back has proven to show great results all around. Um, as we mentioned before, Bounce Back is an adaptive form of CBITS or CBITS for short, which focus heavily on elementary to middle school age children who have experienced trauma from certain certain types of events that I'm going to go over shortly. We have children who experience trauma from violence, children who experience trauma from a separation, children who have been affected by natural disasters or disasters they couldn't prevent at all, and children who are traumatized by abuse or neglect. In the case of violence, we have community violence. So Bounce Back would work with children, urban children who have constant run-in with gang violence or even mafia violence. Family violence. We're talking domestic violence. We're talking um, abuse and starvation, stuff like that. When it comes to school violence, unfortunately, as we all know, there's a bit of a epidemic of school shootings taking place in the U.S., but that's not all. You also have severe bullying as well. There have been students who have been traumatized by bullying. Yeah, violence can really traumatize a child. Then you have traumatic separation, you have death. It's very hard to explain death to a child and growing. Let's say a child were to lose a parent, it's very difficult for them to come back from that, especially when they don't understand the concept of death fully. And if they're the older end of the age range that Bounce Back works with, Bounce Back would do the best that they could to help the child understand what happened and move past it. Incarceration is another big one. You have children who have to watch mom or dad go to jail. That could be really traumatic because, excuse me, because a parent who should be there isn't, and that could be really hard on a child. You have deportation. I'm pretty sure we all remember the ICE issue back in 2016, 2017, where the news posted all these videos of children being taken away from their parents and vice versa. Then you have child welfare detainment, where let's say a child is in a neglectful household, child protective services or child line services, whatever it may be, depending on where you are in the country, will take that child away. And the child being taken away from their parents, whether there's abuse or not, can still be traumatic for the child. Then there's unforeseen tragedies. We're talking natural disasters, car crashes, uh, An honest example of this is dad gets fired, loses his job. Now you guys are suffering financially. That could be traumatizing. It's not listed here, but that's another example. These unforeseen tragedies are something that the child cannot predict or prepare for whatsoever. There's no warning. There is no there's no like pretense to look for. It just happens and then it stops, and then the child is left to deal with the aftermath. Last but not least, we have abuse slash neglect. Um, this is probably the most broad of all of them, and probably the most common, unfortunately. You have sexual abuse, you have verbal slash emotional abuse, and you have parental inattentiveness. When we talk about sexual abuse, we talk about the unfortunate case of sexual assault and child rape. Very unfortunate. We have verbal and emotional abuse. We have children with manipulative and verbally aggressive parents who constantly berate them and belittle them and do things to them that no parent should do to their child. And then there's the third type of neglect, parental inattentiveness, where a parent just does not do the utmost to help the child develop the best that they can. Physical neglect involves letting a child starve or not buying them the adequate clothing they need and letting them walk out in the snowstorm with a sweater on and nothing else. Medical neglect is not technically an anti-vaxxer would count as medical neglect because you're not doing the best that you can medically to help your child live a healthy life. Supervisory neglect is exactly as it sounds like. You are not watching your child, you're not taking care of your child. Your child can literally walk out the door right now and you wouldn't care because you're not paying attention. Environmental neglect is you're not putting the child in a safe environment. Like, for example, an extreme example would be a drug lord producing drugs and their child is in the same room. That's an example of environmental neglect. You putting a baby in a room that's not baby proof is an example of environmental neglect. There's educational neglect, which is when the child you're not like the child isn't in school when they should be, and if they're struggling in school, you're not helping them, doing what you can to either find them a tutor or get them the help that they need. And emotional neglect is exactly as it sounds like. The child's emotional needs are being completely ignored. You are not paying any mind to them, and doesn't matter how the child's feeling, you're ignoring it, you're not paying attention to it, and obviously you're not going to take care of it. All that type of neglect and everything else I said regarding unforeseen tragedies, violence, and separation, all of those are traumatic events that happen to children that Bounce Back specializes in helping children work with, deal with, and move on from.
Now, whenever we are looking at bounce back and the materials that are needed for these programs to truly succeed in schools, uh, it is highly recommended that bounce back is done by a clinical health professional, clinical mental health professional in particular. Um, with that, they have to be specifically trained in it. There are different trainings available, both in person and virtual, depending on whatever the counselor needs at the time, and depending on the situation at hand. Although it can be done by a school counselor, it is highly recommended that a clinical mental health counselor takes the lead on it. Um, Along with the trainings, the manuals and workbooks must also be fully comprehended before they are before any before any information is actually distributed amongst the children. Because if you're unable to maintain a group session like this, it will be far more difficult when you try and help kids who deal with these natural disasters. Uh, so you must be like fully trained within this, as well as like have a classically trained background to be sure this is highly effective.
Just to recap some of the strengths of Bounce Back. Bounce Back, as we mentioned before, is designed to work in multicultural communities and schools to provide help and coverage for students and youth from all backgrounds. We're talking social, economic backgrounds, cultural backgrounds. Doesn't matter what race you are, where you're from, where you live, who you know, what school you go to. Bounce Back is here to help you. As I said before, it is one size fits all. You are free to walk in and you get the same amount of help, and the help is proven successful. It's valid. It's reliable. It does what it needs to do. Um, it also allows students who do not normally receive mental health care to be treated, because Bounce Back is free of cost, it is free of charge, and it is so helpful to the point where they will provide transportation if you can't make it. Um, Students will arrive through normal school provided transport at zero cost to their parents or guardians. Um, Bounce Back is here to help you. It's essentially nonprofit. They're not going to ask you to pay $1, and that makes it very like that, along with the fact that it's very inclusive for anyone from any background, makes a very varied resource. Anyone can use it. It doesn't cost much. Those are the strengths of Bounce Back.
Now, after we looked at the strengths, we have to look at the weaknesses of it. One of the major weaknesses is how the parents respond to it. A lot of times, parental interference will have the child be unable to obtain this help that they need, either due to the parents' wishes, due to their own financial situation. Although we have stated that it is free of charge to them directly, it will cause only more harm for the children, but they're children. They cannot give us consent unless it's under extreme circumstances, but that normally never happens. This intervention is also very limited in its effectiveness. As strong as it is, it does have its limits, just as all other forms of help. Now, when it comes to this, we will have to outsource to not only do work parallel, but to help the child be directed into the proper organization. Because although we are here to help, our presentation here is to primarily focus on natural disasters. If a child is doing bounce back and they're more towards the sexual assault or abuse or neglect side, or the separation and grief and loss, that is something a little different, which we would probably outsource for. As well as the weaknesses already stated, this also falls under the same weaknesses as CBITS that we previously stated, because this is, once again, an adapted form. Although CBITS or CBITS was fully designed for a middle school and high school audience, this is more directed towards an elementary school audience and possibly preschool, depending on how the school district is laid out and the needs that are needed to be met for the populations. Now, in conclusion, we find this to be an ideal program for all people involved, families, teachers, staff members, and just general families, because not only does this use a lot of the pre-existing materials already laid out by the school and communities, it also allows students to be in a far more comfortable environment. If it is something that they've been a part of for 4 or 5 years already, they're going to feel comfortable. Whereas if you bring them to a counselor's office or a third location, they do not have that sort of comfort. They do not have that form of casualness, I guess would be the word to say. But this program not only uses like a bunch of already pre-established tools, we make the best use of them, as well as we put very little strain on the school district. If they do not wish to host us, that is completely fine. We'll try and use the community for it to truly create resources to help these children who have been affected by these natural disasters. Once again, this is far more focused towards the natural disaster. And I hate to sound like broken record, but this is our main focus this time. We not only help with immediate recovery and to help lessen the PTSD symptoms and to try and mitigate it, but we also try and help students and children in particular find these strong and healthy coping strategies to truly help them out for the future. So I would like to thank you once again for coming to our presentation on Bounce Back, a cognitive behavioral program for children who have experienced natural disasters. Once again, my name is Patrick Ace Fair.
I'm Fritz Kelly Edmund.
Thank you once again.